I don't like saying doctors are wrong. I'm a doctor myself. I respect my colleagues. I know how hard it is working in modern healthcare system. But after 30 years of orthopedic practice, I must tell the truth. When it comes to knee pain, most doctors make same fundamental mistake. They don't see true cause. Not because they're bad specialists, but because the system they work in teaches them to look in wrong place. Let me explain through real story. Month ago, a man came to me, 53 years old. Let's call him Dmitry. He brought entire folder of medical documents about 3 centimeters thick. Knee MRIs, x-rays, reports from 4 different doctors, blood inflammation test results, medication prescriptions, 2 years of pain in both knees, 2 years of going to doctors. First doctor looked at MRI and said, "You have early arthritis. Here are chondroprotectors. Take for 3 months." Dmitry took them. Nothing changed. Second, doctor saw slight meniscus degeneration on scan and suggested arthroscopy, surgical joint cleaning. Dmitry agreed, had surgery on right knee, relief for a month, then pain returned with same force. Third, doctor talked about inflammation and prescribed anti-inflammatory course plus corticosteroid injections, temporary relief, then pain again. Fourth doctor shrugged. "Well, you're over 50. It's age. You'll have to live with it or think about joint replacement in a few years." Dmitry sat before me and I saw in his eyes mixture of disappointment, anger, and despair. "Doctor, I don't understand. They all looked at same scans, all certified doctors. Why can't anyone help me? Am I really doomed to live with this pain?" I took his MRI, looked carefully. Yes, there was mild arthritis. Yes, there was meniscus degeneration, but nothing critical, nothing explaining such intense pain that prevented him from sleeping and working. I put scans aside. "Dmitry," I said, "all these doctors did same thing. They looked at your knees, and that's their mistake, because problem isn't in your knees." He looked at me as if I'd lost my mind. "How not knees? My knees are exactly what hurts." "Knees hurt," I agreed, "but pain is symptom, not cause. Imagine fire alarm constantly going off in your apartment. You can turn off alarm, disconnect wires, even throw it out. Signal will stop. But if wiring is actually smoking somewhere, problem won't go away. It'll only worsen. All these doctors tried turning off alarm, your knees, but nobody went looking for where it's smoking. I asked Dmitry to stand, remove shoes and just stand. Looked at him from behind, side, front, then asked to walk. Slowly, naturally. I wasn't watching his knees. I was watching whole body, how pelvis moves, how foot lands, how shoulders hold, weight distribution. Picture started emerging. Dmitry's right shoulder was noticeably higher than left. Pelvis tilted forward. When walking, right foot went sideways and left knee slightly collapsed inward. I asked him to squat. When squatting, both knees went forward far beyond toe line, back rounded. "Dmitry, does your lower back hurt?" I asked. He was surprised. "Yes, sometimes, but not much. I came to you about knees." "And right hip, feel tension there? Tightness?" He thought. "Now that you mention, yes, right hip often feels like clamped, but I thought it's from knee pain." There it is, true picture. Dmitry had problem in lumbosacral spine, mild scoliosis he never treated. This created asymmetry in pelvis. Due to pelvic tilt, his right iliopsoas was in constant tension, pulling hip. This changed his gait. To compensate imbalance, his body started incorrectly distributing load when walking. Knees received excessive and wrongly directed load with each step. Thousands of steps daily, hundreds of thousands yearly, millions over 2 years. No wonder cartilage started wearing and inflammation occurred. But all 4 doctors looked only at knees, saw worn cartilage and degeneration, and thought, here's pain cause, treated knees. But real cause was in spine, in pelvis, in muscle imbalance, in wrong biomechanics. So what do I do? Dmitry asked. I made him a program, not for knees, for whole body, posture correction exercises, iliopsoas, stretch, and other tight muscles, strengthening weak stabilizers, glutes, deep core muscles, retraining movement patterns, how to walk correctly, how to squat correctly, how to rise from chair correctly, work with manual therapists for pelvis and spine position correction. Dmitry was skeptical. But other doctors, I stopped him. Other doctors are good specialists, but they're trained in certain approach. See problem on scan, treat what you see. It's called structural approach. I use functional approach. Look how entire system works, how body moves, where imbalance is. 6 weeks later, Dmitry came again. I saw change as soon as he entered. Gait became more even, shoulders aligned. Doctor, he said, pain decreased by about 70%. I can't believe it. 2 years of suffering, surgery, pile of medications, and nothing. And here, some exercises, and it gets better. That's the problem with modern medicine. It became too specialized. There's doctor for knees, doctor for back, doctor for feet, and each looks only at their area. But body doesn't work that way. Body is unified system. Everything's connected. Problem in one place creates compensations in other places. And often symptom arises not where cause is. Moreover, modern medicine relies too much on scans, X-ray, MRI, CT. These are powerful tools. I don't argue. But they show only structure. They'll show you worn cartilage, meniscus crack, bone growth, but they won't show muscle not activating correctly. That biomechanics disrupted. That load distribution wrong. This can only be seen observing how a person moves. Research confirms this. Multiple studies show MRI findings often don't correlate with pain. People can have meniscus tears, arthritis, bone changes, and no pain, while others have minimal scan changes and severe pain. Why? Because pain often relates not to structural changes, but to how joint works, how it's loaded, how surrounding muscles function. But doctors are taught to look at scans, find pathology on scan, and treat it. It's easier, faster, fits 10-minute appointment, looked at scan, saw a problem, prescribed treatment, next patient. But functional examination requires time. Need to observe movement, check different muscle strength, analyze biomechanics. This can take half hour. In modern healthcare system, there's no time for this. There's financial aspect to ordering MRI, prescribing medications, doing injection, performing surgery. All this brings money to healthcare system, clinics, pharmaceutical companies. But telling patient your problem is posture, here are exercises, do at home, this doesn't bring money. Moreover, it may reduce revenues because patient recovers and stops needing procedures. I'm not saying there's conspiracy. I'm saying system is structured certain way, and this structure isn't always in patient's interest. Doctors work in the system. They follow protocols, do what they were taught. They don't err intentionally. They err because system directs them in wrong direction. So what's true cause of knee pain? In most cases, not what MRI shows. True cause is biomechanics disruption. It's certain muscle weakness and others overstrain. It's wrong movement patterns developed over years. It's imbalance somewhere in system, in foot, in hip, in pelvis, in spine, creating wrong load on knee. Yes, over time, this wrong load leads to structural changes. Cartilage wears, arthritis appears, meniscus damage occurs. And these changes are visible on MRI, but they're consequence, not cause. Treating consequence without eliminating cause is like mopping puddle without closing tap. That's why so many people go through treatment courses, procedures, even surgeries, and pain returns. Because nobody eliminated cause, structure was patched, symptom temporarily removed, but biomechanics remained disrupted. and knee continues receiving same wrong load. Problem returns. What to do if you recognized yourself in Dmitry's story? If you went to doctors, did scans, tried treatment, but pain doesn't go away, look for a specialist who looks not only at scans, but at how you move. Physical therapists specializing in functional rehabilitation. Doctor practicing biomechanical approach. Movement therapy specialists. Be prepared that examination will take time, that they'll ask you to walk, squat, stand on one leg, perform different movements, that they'll check muscle strength throughout body, not just near knee, that they'll ask questions about your history, were there back injuries, foot injuries, how you sit at work, what shoes you wear, and be prepared to work. Correcting biomechanics requires time and effort. It's not pill you can swallow. It's exercises you need to do regularly. It's relearning movements you did wrong all your life. It can be difficult at first, but it works, really works. Your doctor may not be wrong intentionally. They simply look where they were taught to look. But now you know you need to look broader. That knee is part of system, not isolated joint. That true cause of pain often isn't where it hurts, and that correcting this true cause is key to real long-term recovery.